The Western Cape Health Department is urging all residents to take all necessary precautions against COVID-19 following a resurgence there. Spokesperson Shimoney Regter says there's been a 73% increase in new COVID-19 cases and 28% in new COVID-19 deaths over the past 7 days. Regter says sub-districts in the metro which are of great concern, such as Mitchell's Plain and Khayelitsha, have recorded the greatest number of new cases this week. The Garden Route district has seen an alarming resurgence with a reported 117% increase of new cases and a 96% increase in deaths. The town of George is currently leading in active cases in the province. The area has been described as a hotspot, with both President Cyril Ramaphosa and the province's Premier Ellen Winde expressing concern about the second wave of new infections.
Reports from our local surveillance team indicate that gatherings at social events, going to shopping centres while not adhering to protective measures such as wearing a mask and keeping a distance has led to quite a few cases testing positive. We call on all citizens to do their part so that we can bring the situation under control again.
An announcement on further measures to curb the spread of the coronavirus in Nelson Mandela Bay and the Eastern Cape was not made after the two-day visit by Health Minister Dr. Zweli Mkhize. Well, Dr. Mkhize says he will submit recommendations to Cabinet next week before a decision is made. Nelson Mandela Bay is a virus hotspot, accounting for half of the new infections in the country. We are now joined via Zoom by family physician Dr. Fundile Nyati. Dr. Nyati, a very good evening to you. Thanks for joining us. Welcome to The Globe.
Good evening to you and good evening to your listeners.
Great having you on the show this evening, Dr. Nyati. First of all, we've seen Cape Town authorities issuing an alert and a warning to its residents to take all the necessary precautions following a resurgence in that province. Do you think that it'll escalate to alarming levels like we've seen in the Eastern Cape?
If we remember what happened before, Western Cape was actually, the leading province in terms of the numbers, before Eastern Cape, came in. I expect exactly what we saw, earlier to actually happen even now. So basically, Western Cape and the Eastern Cape, the conduct of the people, the behavior of the people with regards to prevention of this COVID-19 is basically the same.
I mean, why is the Eastern Cape where it is now in terms of the infection rates? And I know that you just suggested that it could perhaps have to do with the behavior of the people. But what could have possibly sparked the resurgence there?
Well, I think it's not just unique to the Western Cape or even the Eastern Cape. Generally, people, ever since we moved to lockdown level 1, people have just started to behave as if COVID-19 is history. And so what we are seeing now is basically the results of the fact that people are not taking precautions. We heard from the Minister of Health about a week or two ago talking about fatigue, COVID-19 fatigue. So people have got a lot of fatigue. They are not taking the appropriate measures. And as a result, they are infecting each other. They are going to super spreader events, not only funerals this time around, but also, especially the younger people, they are going to social events where they are actually getting infected. So those are the issues that are driving this. And unfortunately, we are just weeks away from Christmas. And if things continue this way, then we are likely to have a very serious situation by the time we have Christmas.
You mentioned the super spreader events as it could possibly be the catalyst for the resurgence of COVID-19, particularly in the Eastern Cape. Now, when Dr. Mkhize visited that province, the reasonable expectation was that he was going to impose stricter lockdown or maybe stricter measures to contain the spread of the virus. But then none of that happened. Instead, he mentioned that he was still going to go back to Cabinet and make that recommendation to them. So when he comes back to the Eastern Cape, would it be too late? I mean, just looking at the rate of the escalation in that province.
Well, I think every day where nothing has been done in terms of tightening the regulations, we are going to see serious problems. I've been to PE recently, and also have been to East London recently. Basically, it's business as usual. People do not behave as if we are in the middle of the pandemic. So the government can do as much as it can, but the attitudes and the behavior of the people, is a major, major problem. So there has to be the tightening of the regulations. There has to be enforcement of the regulations. And we need to look at some of the things that were done, at level 3 and level 4, reimpose those. The painful thing, though, is that Eastern Cape, its economy is actually not doing so well, if you compare it to other, provinces. So if we now move them to a level 3 or even a level 4, it's going to hurt in terms of the economy. So the government has that balancing act that they need to try and come up with. But at this point, I don't think anything short of taking them back to a level 3 or level 4, will turn the tide. If anything, we are going to see more people dying, in the Eastern Cape.
Let's talk about the capacity. I mean, where are we in terms of the testing units for tracing, tracking, and as well as testing, both provincially and nationally?
Well, again, this is a very important question that you're asking. Again, if we compare the various provinces, the Eastern Cape is the least capable, of these coastal provinces. Here, I'm looking at Western Cape, KZN, Eastern Cape, and also Gauteng, obviously, which was an epicenter as well. When you look at those four, which combined, they constituted almost like 80 to 90% of the cases. So if we look at that, the Eastern Cape has always had a challenge in terms of capacity to test, especially the former Transkei, because then test has to be taken to East London or even PE. So I expect that they will experience the same problem where the capacity to test, to diagnose people, but not only that, the capacity to track and trace, contacts. Also, that was a serious problem before, and I know that is still a problem even now. So it is something that we have to worry about, because if we are slow in following up cases, that means there's no isolation and therefore more spread for people. So that is a major challenge that needs to be looked at as a matter of urgency. Those provinces that have got extra capacity should find a way to support these coastal provinces before this becomes a major, major problem. And a province like Gauteng, which is full of immigrants, I expect that in January, when most of the people from these provinces, Eastern Cape, Western Cape, and KZN come back, the problem is going to even be worse here in Gauteng. And I heard the Premier yesterday actually warning that they expect problems in January. So the Eastern Cape is the least resourced province. It's been like that for long, but they don't seem to have learned much out of the first phase. And right now they are caught napping as a province.
It's said that the misconception that the lower levels of the lockdown are equivalent to no COVID-19. In fact, in a summary to the Department of Health in the Eastern Cape province, officials there have described it as, non-compliance to the regulations at taverns and unsupervised funerals have become public health risks, which may contribute to the spread of the disease. Now, let's talk about the self-defeating tendencies or practices by government departments, including long queues with no social distancing, in particular during the payment of social grants. Can the government be held liable? Are they perhaps, complicit in ensuring, not ensuring in particular that people are, adhering to the restrictions?
Well, if one looks at the fact that now we are almost like 8 months into this pandemic, one would have excused the government for forcing people to stand in long queues waiting for their disability grants and old age grants. You would have forgiven them in April and in May. But at this point, there shouldn't be a situation where people have to go and queue to get their benefits. We live in an age where technology, actually, is ruling for many things. So to have a situation where right now people are forced because they are hungry, People are unemployed and they depend on those grants. So for me, I feel that the government should have done more to actually, prevent a situation where there is a congregation of people. Because you're saying people mustn't go to gatherings. But at the same time, the very government departments that are supposed to provide services to the people, at the post offices, Home Affairs, and other agencies of government, they are actually making people to congregate in small places, So, yes, for me, I think they are complicit in the spread.
Dr. Nyati, the festive season fever is already in the air. People are getting more excited and making plans for the festive season. We know that some will get financial incentives such as bonuses and will be spending it, traditionally in the way that they know how in terms of entertainment. And as we've seen, in some of the entertainment spots, there's no social distancing and people are not wearing masks. And it's highly likely that such a practice will not be followed come the Christmas and New Year's holiday. So would you support perhaps a hard lockdown, especially during this period? Well,
I'm one of those people who are actually saying definitely a hard lockdown in those hotspots. The whole of the Nelson Mandela Bay should be put on hard lockdown. Some of the towns like George, in the Garden Route, East London, in Nelson Mandela Bay, and even in and around, the OR Tambo district, which contains Umtata, those areas should be put on hard lockdown. Yes, it's going to have a negative impact on the economy. However, I think now, again, is the whole argument about lives and livelihood. At this point, I think livelihoods have to, be looked after. More than, lives. We need to save lives more than, the worry about the economy.
And let's talk about the meeting that was held with regards to, Contralesa, with regards to the issue of initiation schools. Would you also support that, the initiation schools should go ahead, especially in the summer season?
Well, again, if one has been following the Eastern Cape before COVID, we know that every December, every June holiday, there's always a high number of young men who die unnecessarily from botched circumcisions, and many others, who continue with psychological problems, from amputated penises. So we obviously are used to that. But when you now add COVID-19 pandemic to the whole mix, you're actually going to have a worsening of the loss of lives. So I cannot understand that, Contralesa and some of the traditional leaders are actually pushing government to lift the suspension, in relation to the circumcisions in that part of the world. It's highly irresponsible for anybody to actually, put pressure on the government. I just hope our government can actually stand its ground, and ensure that lives are saved, because nothing will happen if these things are postponed by a year. In fact, historically, we know that when there is the death of a king or some other important person like that, there would be something coming from the kings to say, well, this year there will be no circumcision. So we are in the middle of a pandemic. So the traditional leaders must actually, do exactly the same that they would do if there was a king who had passed away. So really, anything less than, doing that, that is to tell the whole nation of the people in that part of the world that there will be no circumcisions in this summer season. It will be irresponsible. So I support continued suspension of traditional circumcisions and also those homecoming ceremonies, because alcohol, again, is central when we are celebrating the return of the boys. And we know with alcohol, people do not take precautions, and so they become super spreader events, and then weeks later, we've got more people who are infected and more deaths following.
All right, Dr. Nyati, thank you so much for your thoughts. We appreciate your time. That was family physician Dr. Fundile Nyati joining us live via Zoom. On to other news now. The Southern African Development